Hi, it's Paul. In this clip I want to look at reactive lymph nodes in the context, in this case, of a 43-year-old female who had an enlarged right neck node and a history of breast cancer. I just want to initially review normal lymph node histology with you. So remember, it's made up of those roundish organs, and we have these round structures, follicles, that are arranged around the cortex, the periphery of the lymph node, bit of connective tissue capsule there, and notice how they've got a sort of darker area around them. And these are the cell types that are normally found in these areas. Just cruising around the outside, the cortex, and you can see there's quite a lot of those rounded follicular structures. Now they expand when the nodes get reactive, and tracking down now into the medulla, the center of the lymph node, through the sinusoids there, and we have different cells arranged here. So plasma cells tend to concentrate in this area along with macrophages. And this is normal FNA cytology. Just that blown up stuff is just dead nuclei that have been crushed. But notice that we've got a really dispersed pattern of small, round, blue cells here. These are all just benign lymphocytes. On a bit of high power, again, you can see those blown out nuclei, but then in the background are larger, immature lymphocytes. And we also have sort of a variation from those quite large ones down to quite small ones. So these mature lymphocytes are small in size, and they're predominant population here. So they're probably about 80% or so of the population. They are in the background. Then we've got these larger blastic sort of cells that I'm pointing at. They have a little more cytoplasm on them, looking more plasmacytoid, really quite a lot larger than the nuclei, but notice they're well outnumbered by the small mature lymphocytes. And also notice that there is really gradation in size from those small, dark, mature lymphocytes through to medium-sized ones, and then on to larger ones as well. Notice in the background we've got little bits of grey-blue material. They're called lymphoid globules. They're just fragments of lymphoid cytoplasm. And in the center here we've got a nice big immature cell, and then that variation in size all the way down to small mature. This is the pap stain slide. Same thing, you can see really dispersed population. That stringy material is just smashed nuclei, so that's kind of the DNA material that spreads out and then gets stained. Lymphocytes, pretty fragile cells, they tend to do that quite a bit. I'm pointing there to some larger nuclei and a bit more sort of maybe cytoplasmic material around the outside of them. And these are histiocytic cells. So some of these will be dendritic cells, so antigen presenting cells. Notice they're just sort of scattered through here, and on a bit of a high power you can appreciate the variation in size of nuclei here as well, possibly not quite as well as the Giemsa. That's just a mitotic figure, so that will be seen in benign reactive hyperplasia and in malignancy. But I'm really noticing variable size nuclei. Here we have some histiocytic cells, and you can notice they've got little dots of material in them, and that is apoptotic debris that's been ingested by them, and that is called tingible bodies. So we call these tingible body macrophages. They're seen in reactive, also occasionally in malignant nodes as well. But they're, I guess, a reassuring finding in this setting. We have quite varied nuclei, but the predominant size of nuclei here are very small, mature ones. Just some more histiocytic cells there again. So in summary, what we see in a reactive lymph node are dispersed lymphocytes and histiocytes. They vary in size, but most of them, say 70% or so, are small, mature lymphocytes. All of the cells, being lymphoid, have a high NC ratio, and just that, very characteristic little crescent room cytoplasm. Important to identify that to rule out, say, a neuroendocrine metastasis. Chromatin in lymphoid cells is a bit distinctive. Some people describe it as kind of chunky or blocky. You will see variable prominence of nucleoli. Tingible body macrophages are often seen. And in the context of this case, very important to notice there were no cohesive groups of cells or nuclear atypia that might have suggested a metastasis from the patient's previous breast cancer. So also note that we didn't have really a uniform population of enlarged lymphoid cells that might suggest a lymphoproliferative disorder, but nonetheless we would always perform flow cytometry on the needle washout in order to confirm that there was not a monoclonal population of lymphoid cells present.